Now, are you here right now because you have a cold? What are your symptoms? You got a runny nose, dry cough, maybe some post-nasal drip. I can't really help you. Hopefully the doctor can. But luckily, pharmacist Ira Katz can help you find the right over-the-counter med to bring you some relief.
We're here today to talk about the various different cough and cold medications. And what I think is very, very important for the consumer to be aware of, that there really are very few actual ingredients. What you see in this vast cough and cold area are just combinations of things, as well as individual products. There are only 2 decongestants approved for over-the-counter sale. Actually, one now is behind the counter. That's the old pseudoephedrine, and the other one is phenylephrine. One very important thing is both the pseudoephedrine, which again is behind the counter, you can sign for it, you don't need a prescription for it, or phenylephrine has a tendency to elevate blood pressure. So if you're a patient taking blood pressure medication, you need to be very, very careful. Cough and cold syrups, the liquids, what you find is the plain expectorant. You find the expectorant with the cough suppressant. The DM stands for dextromethorphan. That's the cough suppressant ingredient. The expectorant is guaifenesin. And then you have sometimes called CF, or cough formula. And that would usually have the decongestant, the expectorant, and a cough suppressant. The next ingredient you'll find will be an antihistamine to help dry you up. If you'll see something with an antihistamine, you just need to be aware that in some cases they can cause a little drowsiness. One of my favorite lines is communicate before you medicate. It's very important for patients to make sure that prescription medications or over-the-counter medications, that they consult with their pharmacist.
Now, Ira mentioned some medications don't play well with others. It is really important to talk to your pharmacist about every kind of medicine that you're taking so that you don't have bad interactions. Now, also, your pharmacist will be your best resource in helping you decide which medicines are the best to relieve whatever symptoms you have this cold and flu season.
Need a list of essentials for your medicine cabinet? Text STOCK to 44144 to receive the complete list and be entered to win one of 20 $50 gift cards from Walgreens. Standard text messaging rates apply.
This is not a prescription. This is Mary, who has a million things to pick up each month, on top of her prescriptions. So she was thrilled that her Walgreens pharmacist recommended a 3-month supply and would always be there to answer questions about her health. Now, Mary gets 3 refills in one, and for 3 months, she's done. More or less. Ask your pharmacist about a 90-day supply today. Walgreens, there's a way to stay well.
Talk to your doctor today about getting a 3-month supply of your medication at a nearby Walgreens. Visit walgreens.com to find the location nearest you.
What if a disaster strikes without warning? What if life as you know it has completely turned on its head? What if everything familiar becomes anything but? Before a disaster turns your family's world upside down, it's up to you to be ready. Get a kit, make a plan, be informed today. Learn how at ready.gov.